We know, like us, our listeners spend countless hours every week taking care of loved ones, but most probably don't have an estate plan. Sampson McPhee lawyers can help.
Estate planning allows you to make the big decisions now, like who will take care of your kids if you pass away, and allows you to control how your assets will be distributed and managed.
Estate planning is extra important for parents, common law partners, and people with blended families.
Call Kelly at Sampson McPhee at 902-563-5906 to find out about special pricing for our listeners.
Hi, Jess.
Hi, Sarah.
How are you?
I'm good. It's been a while.
I know it has.
How are you?
I'm good. I'm old now. I'm in my late 30s.
September is always a whirlwind.
It's New Year's for me. Happy New Year.
Yeah. It's a whirlwind.
Start.
We're here, though. We're almost through.
Yeah.
The Burr months.
September is coming to a close and it's October. And October is a very exciting month coming up for some of our friends in the community. And we are excited to talk about that today on this special episode of the Morning Meeting Podcast.
Welcome around the table.
Yeah, we have Stephanie O'Neill and Caitlyn MacDonald with us today, and they're here to talk about Radio Day and the Cape Breton Regional Hospital Foundation. They're here to talk about Radio Day. Radio Day is coming up on October 10th. We are very excited. We took part in Radio Day last year. All of you Morning Meeting community members helped us raise money for the Forget Me Not packages last year. We have been working with the Hospital Foundation on different initiatives and fundraisers throughout the years. So it's a cause near and dear to our hearts, Jess.
And I think last year we were... what did we do? We were on the radio.
Yeah, we were.
Yeah, you came.
I
came to visit you guys.
Yeah,
Yes.
we were at CBU.
Yeah, that's right.
I was a fresh new student.
You were.
And it's a whole year later.
I know.
A whole year later.
Wow.
But the chaos, that chaotic feeling is still the same for you and I, because we were both running like, we're meeting here at this time. See you then. Okay, bye.
Yeah.
See you in a few weeks. Like it was
I
that,
think you
like,
got lost, Jess, actually.
She
You
did.
got lost trying to find us, I think.
Yes.
Yeah.
I can find my way around better now.
Yes,
Yeah.
I've been
bet.
there a year, so I'm a little bit more comfortable.
Yeah. That's
oh my gosh,
right.
that's so funny.
Like any episode, let's start off with an official introduction. Every guest's favorite part is when we officially introduce them and read all the wonderful things about them. You ready?
Sure.
You gals ready?
Ready.
All right, let's do it. Stephanie O'Neill is an experienced registered nurse with Nova Scotia Health, where she has dedicated 16 years of service. Her career began in the fast-paced environment of post-op surgery, then in the emergency department as a staff nurse, where she also gained experience in critical care. Over the years, Stephanie transitioned into leadership roles, managing teams in medicine, critical care, and more recently, the emergency department. Her extensive clinical expertise and leadership abilities have now led her to take on the role of Director of Emergency, where she continues to make a profound impact on patient care and department operations. She is a wife and mother of 3 girls, and outside of her demanding career and home life, she gives back to her community by volunteering on the board of directors for Basketball Cape Breton and Cape Breton Blizzards Hockey, Teal to Heal, and with the Special Olympics Fundamentals program.
You busy or?
Yeah. Listen, I saw Steph's.
So I got a little bit of time.
I said,
I'm listening to
I
that
said,
bomb.
what's your schedule look like over the next few weeks? And then she sent me a photo. And I was like, I'm dizzy. Like, I
Right.
just see color blocks everywhere.
I feel like I just sent you one calendar because I actually work at a 2.
That is
so-
what you said. This is this is one calendar. I have another, but we'll go off this one.
Well, we feel very special that we have this time with you.
Yeah.
I feel like
thank
this
you.
is-
I'm excited.
What an honor.
Yay.
Our next guest is Caitlyn MacDonald. Caitlyn MacDonald, a proud Cape Bretoner, serves as the Manager of Philanthropy at Cape Breton Regional Hospital Foundation. After spending time at West, she returned to Cape Breton almost 4 years ago to be closer to her family and friends. Previously holding roles at the University of Calgary and Dalhousie University, Caitlyn has over a decade of experience in communications, marketing, donor relations, and fundraising. Her passion for giving back to the community led her to join the Hospital Foundation over 2 years ago, where she focuses on connecting donors to causes they are passionate about with the goal of eliminating barriers to healthcare on the island.
Welcome, Caitlyn.
Hi, ladies.
We've got some special gals here on our couch.
So happy to be here, guys.
We're so lucky.
Yeah, and I think it's great to have both of you here because that relationship, obviously, between the hospital and the foundation is so important, but you give different perspectives of your day-to-day and what it looks like and how your work impacts one another. And I think just a lesson for all of us how important collaboration is when working in community partnerships, right? And what we can learn from that. So I'm excited to dig into it. I was going to make the joke, but I know we're in a very official manner here, that Stephanie started her career more than 16 years ago when she was helping all of us on sidelines try to like keep our lives together and basketball coaching or patients or whatnot. So we put her through our own type of like clinical practice before she was officially on any floors, I think, Steph.
You're not wrong.
Yeah.
You're not wrong.
We are excited to talk more about what you do, about the importance of Radio Day, about what our community needs to know about Radio Day and how they can be involved. But maybe we'll just start from the top in case, people, I'm sure most people listening have heard of the Hospital Foundation before, but I don't know if everyone really gets it or understands what they are, who they are, how they're different than the hospital itself, like its separate entity, but how it supports our community, our larger Cape Breton community, the hospital community, etc. So why don't we start off by you telling us a little bit more about the Cape Breton Regional Hospital Foundation?
Definitely. So the Cape Breton Regional Hospital Foundation, what a wonderful, wonderful place to work. So we're a charity, and our goal is to strengthen healthcare in Cape Breton. And obviously that's very broad, but what we do is we fundraise. And what we try to do is eliminate barriers to care for those that are in Cape Breton. It's so funny because the foundation was actually started by a group of volunteers. So a bunch of volunteers coming together, they wanted to rally together to build a hospital. So the foundation was actually formed before the regional hospital was there.
Wow.
There's a fun fact.
Yeah,
Right?
I don't think a lot of people know that.
Yeah.
They definitely wouldn't.
And so our hospital foundation is one of 3 official foundation charities, official register. I'm saying that term wrong, but
Yes,
right?
but we also actually, it's funny because there are actually 42 hospital foundations in Nova Scotia,
wow.
which is crazy, but we are one of the top fundraising organizations on the island.
Wow. Wow.
So we obviously raise funds for Cape Breton patients and their families that come through the regional hospital. So when we're fundraising, I mean, obviously that's very broad what we do, but we fundraise for things like vital equipment. So equipment that is needed on every single floor of the hospital, whether it's the ER, whether it's the ICU, whether it's cardiac services, we make sure that they're equipped with the equipment that they need to do their jobs. We also raise funds for research and innovation, allowing groups in the hospital to do their own research programs. One really special thing that we do at the foundation is we raise funds to enhance kind of the overall patient experience. So whether that be painting a beautiful mural outside one of the units, whether it's making sure that, what's another example of,
Even just some furniture. I know you've
making sure that we have
refreshed some
furniture that
rooms.
that family rooms are equipped with comfortable seating and comfortable TVs and Netflix subscriptions, so that people that are there, it just enhances the experience a little bit. And one of the really unique things that we do at the Cape Breton Regional Hospital Foundation, we fundraise for patient programs. So what we do, we have patients coming in from all over in all the different areas of the hospital. And what we have is a patient fund, which means helping patients who are coming in that maybe they have to go to Halifax for an appointment. We can help them get there. Maybe they have a medication that's not covered by their medical plan. We can step in and we can help support that. So these patient programs have just grown immensely over the last few years. We have a patient fund that's in mental health and addictions. We have a pediatric fund. And last year we actually launched what we saw was a little bit of a gap in some of the patient funds, because we have our cancer fund and we have the Tom McNeil Cancer Patient Care Fund, which has just been, the support we receive for that fund is just outstanding. But last year we saw a gap in terms of how we could support our patients, and we launched what's called the Vital Patient Care Fund. So we saw there were patients that were coming to the hospital that didn't necessarily fall in line with some of those terms of reference on those funds.
Right. To healthcare overall, not necessarily based on diagnosis, right?
Right.
Absolutely.
Yeah.
Absolutely. And that can be anything from, if someone needs to get discharged from the hospital, there's something that we can provide that patient to make sure that they can get discharged from the hospital. There's all of these specialist appointments in Halifax, as we all know. Going to Halifax right now, it's a very expensive trip. And if, you have a diagnosis where, you have to take time off of work and your spouse has to take time off of work, these patient programs help support those patients that are going through these terrible, healthcare journeys. We're able to provide support for them. So it's something that we're very proud of at the foundation. And it's a little bit unique to us as being able to support patients in that way.
When I was a student in the ER, a BSW student, Bachelor of Social Work, when I heard of the foundation and, Radio Day, and I personally donated to Radio Day, and together, on the podcast we've donated. I've never, I guess, really thought about what specifics goes into this? I mean, you see, okay, we're raising a mobile guide cart, and so that's but when I was in the ER, I realized that people were coming in sick, and then once you do have conversations, they were choosing not to take their medications because they needed to buy groceries that month. And when I learned that, I was like, wow, this is way bigger than I thought. This is real life stuff here, and without that fund, Kristen Crow, she's the medical social work for the emergency department. The amount of times that we had to access that fund for these families was incredible, and it was very, very eye opening to me.
Absolutely. And you know what, I know, Stephanie, you can probably attest to this. There was a time
historically when we didn't have a fund, like the Vital Patient Fund, what would happen is it's the evening time and somebody needed to make an emergency trip to Halifax, and the nurses and the doctors and the porters and the cleaning staff and whoever was there would dig deep in their pockets and start and just rally there and try to fundraise to very quickly, to pull together some funds. And so that we would buy gift cards. We actually had a fund that we kind of kept in the office that had some, food gift cards, gas gift cards, something. It's only small, but it helps those families if they're driving behind an ambulance and they, maybe can't afford to do that right now.
Absolutely.
Yeah, seems small and simple, but actually isn't at all, right? What a humongous show of just the importance of community. These conversations and these examples make my heart burst, and I never know where to start to talk about it, because I think it's just, I don't think we can emphasize that enough, that it really, you hear it all the time when you have a baby or when someone loses someone, but it's it takes a village. But wow, it really takes a village at every stage, right, of our lives. And, is it your responsibility? You have this long list of responsibility as a nurse or doctor or porter, et cetera, in that space already. And now you're also saying, well, this person needs us in this way, in this human way, in this community member, neighbor way, right? And I don't think, Jess, you're right. I think it is surprising because we're all so busy, and from our positionality, wherever we are and whatever the world looks like for us, sometimes we can forget that accessibility and equity and these opportunities to this care, it doesn't look the same for everybody, right? We're not all deciding between medicine and groceries. This is
right, and that, but also too, I think it's important to note that these funds are not just for people who are struggling in that moment. Like we were talking earlier, that you get a new diagnosis and your life changes instantly. And I know we talked with Ashley about this on our couple of episodes ago. You have to leave work. your spouse has to leave work or your partner has to leave work to take care of you. You need to find childcare for, like, so many things come into play here. And I think what people need to accept is that it's okay to ask for help.
Yes.
This is what it's here for. This is why the community is rallying year after year for these reasons.
And I think even thinking about what Stephanie and all the other staff at the hospital have done in the past is, coming together and doing that. But I mean, us at the foundation, we have a role to help those patients too. So let us help them too, you know? And I remember, on my first day that I started with the hospital foundation, and like you said in my intro, I had worked out west for a long time. I was in Calgary, which is like a totally different fundraising and marketing world. But when I came on my first day, I sat down with the CEO of the hospital foundation, Paula McNeil, and I was telling her about all these campaigns I had worked on and all these big equipment I had fundraised for, and talking about these wonderful things. And she said, "You know what, Caitlyn? Yes, we fundraise for big equipment, and we make sure that new cancer center is going to be up and running." But she said, "You know what we're fundraising for? We're making sure that when someone comes in, they will leave with a clean pair of socks and underwear and a winter jacket." And I thought to myself, wow, like, you forget that, these things that we sort of take for granted, there's people coming through that hospital that need a clean pair of socks.
Absolutely.
Right? And that's just it. Like, that summarizes kind of that feeling I was getting listening to your, these first few impressions you're sharing, is that at the end of the day, we're just all humans, like, living this very real human experience. And these, whatever health issue you're facing, whatever need you may have, like, we're all in a position of needing help and a lending hand sometimes, and like just being able to offer that in whatever way that looks like. It is just an important reminder, like, people are good inherently. And also, thinking of the history of the foundation and that it was here before the hospital, like, what a unique story to share, in the sense that that group of volunteers made that change happen, right? And it reminds me of, like, the agency, because I know it can be easy. And maybe in Cape Breton, we hear it or feel it a little bit more, or rural communities maybe feel it more, but it is easy to say, like, well, why don't we get ABC? But it's also like, we all have I think, individual responsibility as part of a community to say, like, well, what can we do? Like, how can I help? And that might look different. It's not always sending in a check or making a donation, but maybe it's volunteering at an event or dropping off teas to the nurses. I don't know, but it is.
Or just sharing the initiatives online, like spreading the word. Absolutely.
But I think, like, it's a reminder that, in a community, especially in a rural and smaller community, we together is the only way that we are going to see change happen. And change can never be too small. Like, your participation in this is never too minor. Like, every little thing matters and makes this, big wheel kind of turn. Absolutely. So that so many people can get this help. And I just think, that agency and advocacy amongst community members is so important.
Huge. And I mean, speaking on advocacy, I feel like our role at the foundation is sort of, being an advocate for the patients.
Yeah.
And not only that, but being being that voice and advocating for the healthcare workers who we all know these healthcare workers work above and beyond every single day. And I see it, I'm in my office in the hospital and I see the way that, they just work. I just can't get over the hours that they work at the time that they work. And, I feel like as a foundation, it's up to us to be the voice for them and advocate for them and make sure that they have the proper equipment and make sure that they have the proper means, and that we have to make their jobs a little bit easier, which in turn is going to help all those patients. Right? So it's just like this beautiful ripple effect, I think.
Yeah. The reciprocity and all of that is, like, so important, so evident. Can you talk about that, Steph, a little bit? Like, what does that look like from your side of things? You were on the floor, you're directing, this emergency care now. There's so many moving parts to that. It makes my mind just dizzy, just even trying to think about what that must look like in your day to day and all those moving pieces for you. But can you talk about that partnership with the foundation and what that means for healthcare workers? We know how it can impact patients and their families, but in order for you all to do your jobs the way you need to do it.
I mean, when it comes down to, like, the patient piece of making sure that people have what they need to, to get to that appointment or to get, to go to that during that, especially in the emergency department where, it generally is an emergency when something is happening and you're trying to pull together something at, it's always, Friday night at this time. So, maybe not all the supports are around at that time, but knowing that you have access to certain things to make it a little bit easier for families. But also on the equipment side, I mean, the foundation has done a lot to support purchasing equipment that has impact on patient care, impact on patient diagnostics, impact on even just like the whole experience, like Caitlyn kind of alluded to, refreshing rooms or, painting a mural on the wall or, something like that just makes the space look a little bit more comfortable, a little bit more, inviting. It's not where people want to be. People don't want to be in the emergency department.
Right.
But if we can do something to make it a little bit, a calmer looking environment, a little more, comfortable, I think that goes a long way.
Yeah, it definitely does. That's communication, right? Proxemics, the communicative use of space. Like, you know how it feels to be in certain environments, right? Like the comfy couch or the chairs around a boardroom table, like those give different feelings. They give, that's a different vibe, right? And, and that matters.
And I think, for, our children coming through, a hospital could be scary. So having something that looks, inviting to them or, if they're coming to get their labs drawn or something, that there is something that's a little bit more comforting or child friendly.
Yeah.
It's very important.
And I think, one of my favorite parts of my role with the foundation is being able to connect with all of these different units. So, I meet with Stephanie and I meet with other, managers in the hospital and clinicians and
Caitlyn
staff.
and I meet a lot.
We do meet a lot. We do meet a lot. But, if I can understand where their needs are, then, it's my job to get out in the community and try to find the appropriate group to raise funds for that or that wants to support that. And, it's amazing because everyone in the community has a healthcare story. So, if I understand fully what it is that's needed at the hospital, I can go out there and find the right person. And, some people will say to me, oh my gosh, like Caitlyn, you must get so sick of asking people for money all the time. Like, oh my God, are you exhausted? Like begging for money. And I never look at it like that.
Right.
I look at my role as a way to give people an opportunity to give back to their community and to give back to healthcare. So I don't look at it that way. I don't look at it as me asking for money. I look at it as finding a group that wants to contribute to healthcare in a way that's going to, impact patients and that's going to also impact them and give them that good feeling, So
And that's a ripple effect.
it's a ripple effect. It absolutely is. So
And we never know when we're going to need to access that fund.
that's right.
Right?
That's
and
right.
I think that's a big piece that like, we're not invincible, like we're out here, one day raising money and then the next week we might need to access this fund. So I think like just having that thought process and I think too, people are so generous and we've seen that over the years of us fundraising, like people really do want to give back.
Yeah.
They really do. And we've seen that like, wow, like our minds have just been blown with like the generosity of the community. And, I don't think that's going anywhere.
Yeah.
No, I know. And we are so
I think
lucky.
that is the Cape Breton way, though.
It is the Cape
really
Breton way.
Absolutely.
Yeah.
Like when
that's special.
I never heard that story before. So thank you for sharing just even about how the hospital foundation started, that it was a group of volunteers before the hospital. That doesn't shock me though.
Yeah.
Because our community always comes together when they need to.
I know.
They really do. They really do. And you see these groups who are, it's anything from 5-year-old kids who are sitting in their driveway selling lemonade.
Yes.
Because their grandmother was diagnosed with cancer. Or it's, the person who puts a fundraiser on or a hockey tournament in memory of someone that they've lost. It's just so beautiful to see. But I think people can get a lot of, it helps people grieve.
Yeah.
It helps to know that they're helping others who might have been in their same position.
Probably gives them purpose. Like it gives them a sense of purpose, right?
Yeah, definitely. It's a way to celebrate life and legacy and memory. I think of fear, maybe not our own fear of our, like when we're gone, but our fear of our loved ones is that someone's going to forget them, right? Like you always want to keep that memory alive. And I think this is such an important special way that people can do that. I think it's funny, to hear people say like, don't you get tired of this, Caitlyn? Yeah. Hearing you speak about it, I think it shows the importance of communication, and really you're a bridge, right? Like you're a bridge connecting the need to the people who want to support the need. And it's hard to know what needs what, or what's important, or what, piece of equipment may be really beneficial at this given time for the hospital, unless we have someone making those connections for us, right? What does that look like? You guys run into each other often? Is it like you're passing each other in the hall and being like, oh, by the way, we need this machine. Can you think about that? Or like, what is there
sort
a
of
list? Like, Stephanie, from your
She's
perspective,
around the corner from me, so
Yes.
we see each other often. But
I assume there has to be some sort of like prioritization of need. I know, in our community and elsewhere across the province and country, most likely is that we probably are seeing, an increase in requests, and we see patient visit stats growing and, just coming, I don't know if we can say on the other side of a pandemic, but going through what we have in healthcare recently, I'm assuming the need maybe is greater now than it has been ever, or growing, or staying consistent. So how do you...
It's not going down.
It's not going down. Yeah. Yeah. So how do we prioritize that? How do you know what you need and where you need it?
Caitlyn has reached out in the past, which is great. Even just getting us to think about, what's important, or what, from an equipment piece, like, what do we need, or what, what's at end of life, or getting there. And it's been great to be able to connect and kind of provide that information so that, like she said, she has a list of things that are important.
Yeah.
And that when she stumbles upon the right person who's interested, and maybe somebody who wants to, to give back, or to, provide some sort of financial assistance, they might not know what they're looking for. So if she's able to give them, this is, some needs that we have, they might, jump on that and say, do you know what, I'd like to do that.
Yeah.
So I think that has been really great, and it's been nice connecting and being, able to communicate and keep those lines of communication open.
And kind of more a part of the process, right?
Yes.
Because, who am I to go into the community and say what the hospital needs?
Right.
I have to be able to, I have to talk to the professionals, the ones who are living it every single day.
Yeah.
Right. Yeah. So that inventory list is like this living document. I mean, I don't know if the inventory list is really the right way.
No, it sort of is that. It is
I'm
that.
a visual learner in my head. I'm like, this is what it looks like to me. This list where, this piece of equipment is X years old and we use it this often, or we need another piece of this, or we could benefit from this, or this department needs this. And then you see that and you're able to kind of connect the people to those.
And I think, I don't make that list. Let's be clear here.
Right.
I ask the people, like the staff, the physicians, the people that are going to be using the equipment.
They're working with it every day. Yeah. Right.
Are you ready to foster a deeper connection with your child and grow yourself in the process? Welcome to Conscious Parenting Coaching with Cheryl Fogarty, where your journey to enlightened parenting begins.
Cheryl believes that to truly connect with your child, you must first dare to grow yourself up. Her personalized coaching sessions help you communicate effectively, manage stress, and create a harmonious family environment.
With a unique approach that combines the latest in child psychology, mindfulness practices, and compassionate communication techniques, Cheryl guides you through the challenges of parenting with wisdom and grace. Whether you're dealing with toddler tantrums or teenage angst, she's here to support you every step of the way.
Join a community of conscious parents who are transforming their families one mindful moment at a time. Visit www.cherylfogarty.com or find Cheryl on Instagram at @theconscious_ish-mom to schedule your free 30-minute discovery session with Cheryl.
Conscious Parenting Coaching with Cheryl Fogarty, where mindful parenting meets joyful living. Because every moment with your child is a chance to grow together.
And I think, Sarah, you kind of alluded to this increase in numbers. And over the last year or two, we've seen a 72% increase in terms of requests that are coming into our foundation, and also in disbursements. So, as fast as we're getting the money in, because we're spending it.
Yeah.
And because the need is so great, it's a good and a bad problem, right?
Yeah.
We're getting all this money in, and people are so giving and generous. And, we do these big events and we have these third-party groups who want to fundraise for us. But, we get that money in and we see these requests come in on the daily,
I think
right?
that's good for the community to hear as well, that, the money is not just coming in and sitting somewhere.
Right.
It is being utilized
Every day.
Every day.
Yeah.
It's being accessed. So that's really important.
And reiterates that importance of those partnerships, right? Like internally partnerships, with the hospital and the foundation and the staff and people being able to communicate that through the right channels, and then you communicating it to the community. But those partners that you've worked with in the past, who continue to work with the foundation, incredible, but always room for more partners and partnerships and initiatives to come on board as well.
Definitely. And I mean, we have so many wonderful partners in the community. And I think, we've built this group of kind of allies, I sort of call them. And these people share the same vision as us. And they want to eliminate barriers to care. So, when they're thinking of a charity of choice, or they're thinking of a way to give back to their community, we've noticed these partners, they're aligned with us. Yeah. And it's such a wonderful thing to see. And, I don't want to say my job's easy, because it's definitely not easy.
Right.
But the people, our partners and these people in the community, make it so easy for me.
Yeah.
They really do.
And I think you have a great group of organizations like, Caleb's Courage, Teal to Heal. Like, there's lots of volunteers that are involved in those groups that are, bringing
Absolutely
awareness, bringing money in, like,
and that's absolutely huge, because you think of Teal to Heal, for example, Dina Edwards-Wadden. I know you're on the committee, Stephanie, and she started this run because of her own cancer diagnosis, and she has blown everyone out of the water in terms of what she's been able to achieve over the last few years. So she took her own journey and she created this wonderful fundraiser that has raised almost $500,000 for the foundation.
And awareness, like
awareness.
just starting
Most
conversations that
Most
people
important.
have not been talking about publicly before now.
It's true.
Like
It's true.
and that's like, that's a vulnerable experience to go through on your own, but then to use that, like you said,
for the better
of the community. Yeah, that's special.
And she's not the only one. We have, Claire Chabasal, she puts a run on. She sadly lost her father to lung disease. So she started a run to honor his legacy. And now we're able to provide support to patients who have to go to Toronto and await lung transplants. So because of what she did, we're actually helping patients get to Toronto, and you see this impact immediately.
Yes. Yeah.
And you have to live there for isn't it like a month or 2 months or 3, whatever it is? Like, that's a huge burden.
Absolutely.
Right?
And to see that what she's doing for us is helping these patients and these people who were probably in this exact position that her dad was in, right? So it's just a beautiful thing to see.
How does that come about, Caitlyn? Can you walk us through what that looks like? If there's someone out there who wants to start an initiative, or, the Claires, the Dinas of the world, Caleb's Courage, all of these initiatives that start, like, they all, from what I know, have started from a pretty personal journey or experience or story. Do they reach out to the foundation and connect and go from there? Do you reach out to them? What does that usually, maybe there's a few different ways, but what does that look like?
And it comes in all different forms, but yes, connect with us. This is such a huge part of our foundation, and this is what makes us so unique. Like I said, I was out west for a long time doing similar work, and I have never seen anything like this, where it's these people who just want to give back, and they have a story to tell, and they, definitely connect with us. That's what I would say. Meet with us. We will help you plan an event. We will help with your fundraising efforts. We will help promote it. We will do whatever level you want us to be involved in, we will be involved in. It's almost like, I feel like groups in the community, they're kind of feeling like, okay, if I'm going to give back to a way in my community, I want it to be to healthcare. And I have this story and I have this, and we can actually help them facilitate, plan the fundraiser. We can help them execute it. We can be their day of. So it's we definitely are always encouraging. And every single year we see new groups, you know, this is going to be the first ever.
Yeah.
And then all of a sudden you see it's a second annual. It's a third annual. And you're thinking, oh my goodness. And, you know, someone like Dina, who was going to do an event one time, and here she is, she already put the save that out for the next one. I mean, God love her. I don't know how she does it, but you know, and there's so many people in our community that are doing that are, and they get a little taste and they see that impact and they feel kind of a part of this. And so yes, absolutely. I would say to anyone out there who's wanting to plan a fundraiser, connect with us. Definitely.
I had an email from a student teaching right now, actually, and she reached out to promote a fundraiser that they're organizing. So I'm reading this email, and the fundraiser is a kids run 5K, and I'm reading the email, and it's hosted, and it's this date, and et cetera. And it said, I attached the link to the website so you can learn more about it and the reason why I'm doing it. And it's called Unblock the Clot. And when I clicked on the fundraiser, it's a hospital foundation fundraiser. Right. And I was so proud of her. And she's in my media class, and she said, you know, I just want to share with you because this is a way that we're using media to share the story or to fundraise for this important thing. And I said, you know, we'll be there. And then I said, you know, my sister-in-law works for the foundation. It's a really important cause for us, and so proud of you. And then I read the story and realized it was her own story, and I had no idea. And then I just said, like, thank you for sharing. And, you know, this is so vulnerable, and you're going to make change, and, you know, you're an agent of change, and you're the citizenship that you're engaging in, because the course is kind of about that. You're living the theory in action. Like, here you are. And I think, you know, it took her courage to do that, but then it took a foundation in the community to be able to connect with to execute it, like you're highlighting, right? And it, you know, she's a university student, like a young student who, you know, is doing this on her own. And I just think that's so inspiring to see how those connections are made, because foundations exist in our community like this.
Definitely. And like you said, serving that bridge for the community and for the hospital.
Yeah.
Yep.
Yeah. We've been a part of it, Jess. Like TM, you know, the Morning Meeting podcast has fundraised for certain initiatives important to our community members, important to us personally, together, collaboratively, our families. I think both of our weddings, we raised funds and donated back to the foundation for different causes that were near and dear to our people. Most recently, our wine and dine event raised enough money to fully fund the mobile Gine cart, although I will forever call it the wine and dine cart, but there is no wine on that cart. The mobile Gine cart, which, can we say, just arrived?
It has arrived.
In action in our emergency department now.
It is. It's fully stocked, ready to go.
Which is just, we've heard the impacts that will have. I personally know the impact that, you know, you talk about space and places, and like not having to go into a certain room for a certain exam means a lot to people who have been there prior. And I just think this just, again, the accessibility of care that these things provide are incredible. We can't do that without community. We felt the effects of that. The Forget-Me-Not packages last year for Radio Day, Caleb's Courage we've been a part of. We've been so lucky and grateful that we've been able to connect with the foundation, to work together, to share the cause with our networks, and our community members have been so incredible to support the causes in their own way. And this year's Radio Day is coming up October 10th, and each year focuses around something, right? Am I right to say that?
That's right.
There's a goal to Radio Day. I believe this year's rally cause is the portable ultrasound machines. I want to know more. Can you tell us the who, what, when, where, why of Radio Day, and also the importance of having these portable ultrasound machines?
You can address the who, what,
yes,
when, why.
I'll do the who, and then I'll pass it over, Steph. So Radio Day, it's one of my favorite days of the year. So it's basically just this big day of giving in our community. So we sort of take over the radio station. Our partners at Stingray, 101.9 and 103.5 Country. New Country, we bring together all of our partners in the community. We have them come into the station to celebrate what they've done for us this year. We celebrate patients patients and we tell patient stories. We have healthcare professionals coming in and talking a little bit about the cause and why it's so important. And the day is just, we have volunteers calling people, inbound calls and outbound calls. We're also calling people to try to get them to give. And I know, Stephanie, you were a volunteer last year.
I did. Yeah. That was my first volunteer experience at Radio Day. And I might have got a little competitive. But,
I was just going to say, how did that turn out for you?
I might have. Yeah. Ask a few friends who I cold called and and was able to get
and
some.
And you had a competition with someone else that was on the phones as well, right?
Yes.
You guys were trying to see who was going to raise the most.
Yes. Yeah. I won. Just so you know.
I knew that. I didn't even have to ask.
Krista will not be happy to hear that I put that out there. But it was really exciting to be a part of it. I signed up for this year again to do. I'm not going to do the whole day this year. My day's a little looks a little different, but I am going to do a couple hours this year, and I'm excited.
And it's a feel good day. It really is a feel good day. The volunteers that are there just absolutely love it, and we have the photo booth and the video camera, and we have these groups that have fundraised for us that are going on air, and they get interviewed and they get to share, why they've done this and what influenced them to want to give to the hospital foundation. So all in all, just a feel good day. And like you said, Sarah, we are fundraising for portable ultrasound machines. And similar to kind of what we've talked about is, Stephanie and I had met, and some of the cardiologists had met, and we said, this is a big need at the hospital right now. So an easy sell for us. And Stephanie, maybe you can give a few more details on the portable ultrasound.
Sure. I know Dr. Paul MacDonald and I had met with you and Paige and discussed the importance. And really what it does is it allows for in the moment, fast, quick diagnostic to be able to make a quick clinical decision. And that, it's in the case of an emergency, you have a trauma coming in, you have, somebody coming in, in a different situation, maybe it allows the clinician to be able to look quickly and, maybe differentiate between one thing and another. And it allows them to make a fast decision that really impacts the patient. We also use them for procedures. If we need to put, some sort of a central line in for quick access to be able to give life-saving medications. They'll use them at the bedside in those areas as well. So we do use them in the emergency department and in critical care, so our ICU and CCU. Right now, there's one in the critical care areas, and we do have one in the emergency department. But it's not enough, and we've come to realize that when, how do you make a decision of if you have a multi-victim trauma coming in, and they need it in a couple areas at the same time, well, it's where are we giving that? Right? Yeah. So to have more, and we have to clean them afterwards, and there's,
and who's
processes.
Making that decision in this fast-paced environment where other important decisions are being made.
So really, really important that we have access to more than one.
Yeah.
I guess, I can tell a bit, I did have permission to tell, a story of
please share.
Something that just happened recently. We did have I witnessed it because I, was down in the department, but we did get to see it in use where I won't give the intimate details, of course, but we seen it save a life of someone 38 years old that came in, and the physician was able to very quickly diagnose and very quickly make a very important clinical decision. And his quick action, his ability to use that machine and have a diagnosis and be able to treat is exactly what saved his life.
Wow.
And
having access to that machine in that moment.
And I mean, he was very, very sick, and did have a time in ICU after that, but he's doing well from what I hear. And I've spoken to some family, and I think the family is sharing a story on Radio Day, or will be. So, folks will hear that story in a little more detail, but it was very apparent, and, it really it impacted me that day, realizing how important that was for that family, and for, for the community, for the physician that was there to be able to, do a good job and save a life. Right.
And without that piece of equipment, could not have known what was happening officially to make the call that needed to be made in the moment.
Exactly. And there wasn't time to go to the ultrasound department and have, a formal ultrasound done, which is really important, to recognize that it's all about time.
Yeah.
And when you don't have that time, like, you need to make that decision quickly. So.
Right. Oh,
So the goal is to raise money for how many of these machines?
4.
4.
Wow.
Okay.
Yeah, to be utilized in the emergency department in our critical care areas.
I'm curious, for those who want to volunteer, how do we go about doing that? Because I'm sitting here thinking, like, I think I'd like to volunteer for Radio Day.
Jess, I would love that.
I'd like for you to be there 12 to 2. That's where I'm going to be there.
Yeah. Can we join the competition?
Yes, I would love that, actually.
Sarah, are you
love
up for
to
some
get
new
out
competitors, Steph?
Sarah, you and I don't do well in competition
I know,
together.
we really don't. But it will benefit the foundation if we go toe-to-toe on that.
Deal.
That is true.
Jess and Sarah, we'd love to have you guys there.
Yeah.
And you guys will be there because you'll be celebrating everything that you guys have done for us this year too. So it would be great to see you there.
Yeah.
Awesome. So I can call the office.
Yes.
Sign up.
Yep.
What are the hours for the day? Like, what are we, like, for those who are working during the day? Is there evening? Like,
And where's
Definitely.
the hub?
So we are going to the radio station.
Okay.
At Cabot House.
Okay.
On Kings Road. So we'll be there all day. We start at 6 a.m. So if you're an early bird, we could have you in before work hours.
Yeah, okay.
And we go until 6 p.m.
Okay.
And throughout the day, we're taking donations online, over the phone. Like we said, we have community groups coming in to visit us all day. It's a feel-good day, and you do not want to miss it.
And there's a few power hours throughout the day, I believe, right?
There are power hours.
Yeah.
And those, so during the power hours, there's one in the morning, 8 to 9, 12 to 1, 4 to 5. And during that time, guests that call in and want to donate, groups will be matching their donations. So Miko Construction DKI, Schwartz Furniture, and Jim Sampson Motors, they're coming on and they're matching the donations that come at that time.
Amazing.
We also have an online matching sponsor this year. So CS Boudreau Holdings Limited, he's going to match anything that comes in online.
Wow.
So
I'm
So
no
if you-
mathlete, Daniel, but if you are donating during those times or online, I think it's more bang for your buck, right?
Yeah.
absolutely.
money
Doubling
there.
the impact,
Doubling the
right?
impact.
Oh, I love that.
It's great. What were you going to say, Steph?
I was going to say 6 a.m. till 6 p.m. I wouldn't recommend doing the whole thing. I might have done that.
Of course you did.
But
She was a little tired at the end of the day. She was a little
definitely
tired at the end of the day last year.
And then I spoke on the radio, I think, for a
did.
bit. And there was that, it's a thing that,
the 360
the
camera.
360
Oh,
camera. I
yes.
spent some time in there.
Yeah,
like,
that's some fun in there.
It was a feel good day.
And as you can tell, as soon as Stephanie and I have connected, I just make her do everything now. And she is at every event for the foundation.
It's because our offices are really close.
Yeah,
That's
very
why.
close, very
I'm the
close.
first
Is
one.
there, am I right in saying that there's people standing around with like accepting donations on like the corners of?
Yeah, so there is going to be a bucket brigade.
Okay.
So at the Kenny's Pizzas locations on that day, they're going to be collecting donations, and through the hospital gates, we'll also be collecting donations. Yes.
So there's so many areas to
So
be a
many
part of
ways to give.
Yes.
Definitely.
Awesome.
And I think the beautiful thing about Radio Day is it really, it goes back to the start of this conversation, the impact of people's stories and the reminder of just like your humanness, right? Like you may have a story, you may have your thought, you might work in healthcare, you may have a story about a recent experience in healthcare. All of these things come together, but it just reminds us, like at the end of the day, all these human stories, this impact just hits you right in the feels. I've never listened to the radio longer or more intently. I'm like shushing people and listening to these beautiful stories. I'm crying my eyes out driving wherever I'm driving. Like it's...
I think you have to think too, like healthcare is one thing that affects everyone.
Yes.
Because everyone needs, no matter, like right from birth, you are accessing healthcare
Right.
until the end,
Yeah,
right? And
that's
your
right.
family and, nobody is exempt from, accessing healthcare.
That's right.
In some form. Right?
That's right. And like as we help and collaborate and, I was going to say donate to our community, but I meant give to our community in whatever way. That's what leads to healthier, thriving communities.
And it
right?
doesn't mean that you have to open up your purse.
No, yeah.
Just your time.
Right.
Right. That's a huge impact.
Yeah.
So,
Every time we drive by the hospital, which is every day on my way to work, the twins especially will say, "That's my hospital." They think they're the only person ever born there. Like, that's my hospital. I'm like, yes, it is your hospital, but it's also every other person's hospital.
yeah, that's right.
No
It's
one
all
tell
of
them.
ours.
No one tell them.
I love that.
They think they're the only ones who were born there. It's my hospital. This has been so wonderful. Radio Day is, we're just about outside a week away from Radio Day. Next week it's coming. We're so excited to be celebrating with all of you. Thank you both for leading the charge. Thank you to your teams for leading the charge in these initiatives, day after day, not just Radio Day, 365 really, 366 this year. It's a leap year. And we are just so happy to be a part of it. The morning meeting community members, I know, share that sentiment. So not too late to volunteer.
Not too late.
Summarize all these notes. Not too late to volunteer. Reach out to the Hospital Foundation if you're interested, if you want to take part in some part of the day, or like Steph, go for the whole 6 to 6. See how you do. You can donate online by calling in, by someone calling you, and any of the bucket brigades that you may see. Can you donate early or only on Radio Day?
No, you can definitely donate early.
Okay.
Yep.
So
and
after.
online and after. So right now the website is up and running. You can make your donation online. You can give us a call. I'll give you my cell phone number. You can call me anytime. Okay, text me, call me, anything.
Maybe
and I'll
we
any
won't
time of
put that
day.
out on air right now, but if you want Caitlyn's cell phone number, you let us know.
Yes, there we go.
Text us.
There we go.
And we can follow along, right? And I think the Hospital Foundation's been pretty great on kind of taking us along on the day on their social media.
Yes.
You can look for the Cape Breton Regional Hospital Foundation across social media platforms. Their website will give you the information you need. Our radio partners, you'll listen to all the wonderful stories on there.
And I think it's important to note as well, if you're not around for Radio Day, there's lots of other opportunities to give back
Yes,
all year round.
Yeah.
The foundation works hard all year.
that's right.
Thank you, Stephanie. Yeah, we do, and it's a busy spot to be, but what a wonderful
It was
place.
so rewarding.
So rewarding.
Do you
and
have like a here I am back to my lists again, but do you have like a volunteer list that someone can add their name to and just be
Definitely.
called upon for?
absolutely.
Okay.
Yep. And we'll take your email, your phone number, and whenever we have events that are coming up, we'll give you a call. Definitely. We have an ongoing list that continues to grow. We're so lucky. Like we said, people love to align themselves with us, and we just love meeting all these new people who want to be a part of our team. I joke about that, but I'm like, I feel like, our team is like the whole island of Cape Breton, because everyone's working together. And I think I have to give you both a big shout out for everything that you've done with your own networks and being able to fundraise for us, and seeing that impact. Now you have this piece of equipment that you were able to fund, and I think that's just amazing. So I just want to say thank you to you guys for being such a wonderful part of our team too.
Send us the inventory
thank you
and
for
we'll
saying
figure
that.
out
Yeah,
what we're
what's
gonna
next?
There's a
What's
big
next?
list. Jess, there's a big list.
What's next? Yeah, we're in.
We're up for the challenge.
That's right. Thank you so much for saying that. And it's always been an honor and a pleasure. And thank you all for leading us through this like you do. When Steph sent the picture of the cart, I think my response was, that is the most beautiful thing I've ever seen in my life.
It absolutely was.
Just the cart, the stirrups. I'm like, I've never been so happy to see those little, is that what they're called? The
Stirrups.
Yeah.
where you put your feet.
She didn't mention the fact that they didn't know where things went in it, and I just had to do a little edit draw on the
I'm a very
text.
visual learner.
Yeah, one of us weren't sure. Like, where, if you're putting your feet there,
Where's the rest of you?
where's
Yes.
the rest of you?
We
And
got it.
Thank goodness you're,
Thank God,
you're
I
also
am
a
very
creative,
good
Stephanie.
stick man driver,
that's right.
stick woman,
That
stick
was-
person.
That was
Yeah.
a level up for my stick people. So that was well detailed. That gave us the visual we all needed. Yeah, and that was the most beautiful piece of equipment I've been showing everyone. It's like one of my children on my phone. I'm like, look at this. They're like, what am I looking
With
at?
or without the stick person.
Without the stick
Yeah,
person.
without-
Only because you see that the bottom half of the stick person in the smaller photo.
I get you.
Yeah.
We'll have to share it on our stories.
Yeah,
maybe.
we will.
For
Yeah,
reference.
Yes, definitely.
Yeah. We'll take you at that step.
Yeah, with my draw. That's
Usually
good.
those
with my
stirrups
drawing.
give us the little shivers, but that was a beautiful sight to see
Yep.
that day.
Well, we were
exciting.
excited to see it arrive as well.
It's great.
Thank you so much for joining us around our table.
Thank you for having us. It's been so fun.
It's been fun.
Yeah, this has been awesome. See, easy peasy.
Easy peasy.
Not so hard.
Easy peasy lemon squeezy.
That's right. And we'll see everyone on radio day, right?
That's
yeah,
right.
Radio day.
Yeah, I'm going to call tomorrow. Get on the
Love
list.
it. Awesome.
Well, you probably could just...
Yeah,
Tell
I'll
her
give you
you
my
want
number.
to
I'll
do
give you my
this.
number.
Oh, I
Yeah.
get your number.
I'll get my number.
Okay. I'm like, I'm going to call Foundation.
They'll be like, cool.
I think we know a few
Actually,
people.
I might call though, because every time I remember I called the Foundation once, and is it Brittany
Yes.
that answers the phone? And it was the most friendly. Like, I thought it was like a recording or something, and then I was like, "Oh, wait, is this a real person?" Like, it was the most friendliest. I was like, "Oh my god, like you are the most friendliest person I think I've ever. Like, you just made my day."
She
so
is
I
the
might
sweetest.
call.
She
you
is
might
the
just
sweetest.
want to
Call her
talk
just
to
to chat
Brittany.
with her?
Yes,
Yes. And she answers those phones all day. And
Oh,
my God.
hi.
Yeah.
Oh, yeah. So
She's amazing. Our whole
sweet.
team is amazing. I have to give
Yeah.
our whole entire team credit.
Yeah.
You do
It's
have
not
a
just
very
me.
sweet
We
And I
have a
think it
very
was like
wonderful
a
team.
Monday morning at 8 a.m. You know, like it wasn't Friday.
Yeah. It
at
doesn't shock
4:30.
me at all.
Yeah. Yeah. Amazing.
Yeah, very special team. I'm very proud of certain people on that team for sure. Of all of you.
You should give a shout
You
out
might
to
have
Paige.
some, you might have some bias over there.
I do have a
Yes.
little bias, but very proud to see my sister-in-law and all the work she does. And I think just, hearing her talk about the wonderful team and the impact, and just knowing the impact it has on all of you because of the work you're doing each and every day. Like that is emotional labor. All of the work that you're
Definitely.
doing day in and day out, Steph, you too, and your team, like it's emotional labor. Not only are you skilled and talented and dedicated in the actual, work you're doing in terms of whether it's communication or healthcare or marketing or surgery or whatever it is, but also just caring for humans and community in this way. That is emotional work, emotional labor, and
It
takes
is. And-
special people to do all of that.
And it's funny you say, Paige is our manager of marketing communications and such a wonderful, wonderful part of our team. And it's so funny though, because sometimes you'll see people who we're walking down the road and they're like, oh my God, there's that purple coming. There's the purple. And they now connect purple to the foundation. And that's all because of Paige and how she's been able to just
Right.
develop this beautiful brand for the foundation. And, anytime I'm so proud to wear this purple, but we're definitely known out there. And sometimes people are like, oh no, they're coming. They're coming. I'm
Well,
going
one
this way.
day
I see the purple.
Yeah, I see the purple.
There was a patient in emergency, and there was a new cancer diagnosis, and there had to be life flighted, and it was a very quick turnaround of we need to get this support for this person, but they're waiting in the wings for the flight, we have to whatever. So we called over the cancer center and we talked to the social worker over there, and then we contacted Thomas, and I literally ran over the pedway and he was there greeting me with a purple bag that was filled to the brim with gift cards for this person, and we gave them the purple bag filled, and they were so grateful, and then off they went. But yeah, I felt a certain way when he handed me the purple bag. I was like, wow, okay, yeah, and then I bolted back over.
I love it.
Just running with my little purple bag. Yeah,
Purple
but it's
Purple has always been my favorite color. So this,
go.
when I saw you walk in with this sweater, I was like, ooh, how do I get myself one of those
Yeah,
nice
We'll see
little
what we can do.
purple
See what we
sweaters?
can do for you.
Yeah, they look great.
I know, don't they?
Yeah,
Yeah, they're beautiful.
purple.
Purple,
That
purple,
was
purple.
good
All
choice.
Coming from the person who only wears black, I wasn't really into the purple, but you guys look so awesome.
Thanks, Sam.
I was inspired today. What did you say, Steph, when you walked in? Oh, your outfits are always so interesting. I said, I don't know how to take that, but thank you.
Yeah, it's
Inspired.
beautifully interesting.
Yeah, sure.
She could wear a paper bag. I mean, let's be honest.
Thank you. Purple's the color. I like that choice too, Paige. Way to go, sister. Thank you again for joining us. Thank you and your teams for all that you do. Thank you to the community for continuing to support the Hospital Foundation, our healthcare workers, our community members seeking equitable, accessible care. It's been so lovely and heartwarming to see everyone. And you're right. People just love to give here. And Cape Bretoners are a special bunch. And I am so proud to be one. And especially days like Radio Day, it warms my heart. I don't know about you, but when people ask where I'm from, I say Cape Breton, not Nova Scotia. Feels,
Always.
Always.
I'll follow it up with Nova Scotia, but you need to get Cape Breton in
Yes.
there because that means a little something, and especially so on Radio Day on October 10th. So we will see you, hear you, be watching all of you, be listening to all
Donating.
of you, donating.
I will
crying,
see the two of you from 12 to 2.
Yes.
Yeah.
Yes. Sounds
Sign
good.
us up. You're sure here.
Listen.
No sore losers.
been a
It's all
while.
for a good cause. We'll see you out there. All right. We'll see you all on Radio Day. Tune in to the Cape Breton Regional Hospital Foundation socials now throughout the next week or so, especially on October 10th. And we will see you all on radio. Thanks, Radio Day. Thanks again, guys.
Thank you guys.
Bye.
Bye.